Welcome back to the Today Show, and on today's show we will be talking about the mental illness that has resulted in more than 200,000 U.S. cases per year, schizophrenia. Today we will have some segments with some featured guests who have either experienced the disease or treated on a day-to-day basis. Welcome our first guest, Dr. Ross, who will tell us about the mental disorder. Hi doctor, how are you?
Good, how are you?
I am good. Can you tell us a little about your profession?
Yes, so I work at Mass General Hospital in Boston in the psychiatric unit, and I specialize in schizophrenia.
What is schizophrenia?
Schizophrenia is a long-term mental disorder involving the breakdown in the relationship between thought, emotion, and behavior. This is a faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationship, and into a fantasy and a delusion, and a sense of mental fragmentation.
Are there any causes to this disorder?
The exact causes of schizophrenia are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop the condition.
What are the targeted ages that this disease affects the most?
Usually between the ages of 16 and 30, symptoms such as hallucinations and delusions start. Men tend to experience symptoms earlier than women. Most of the time, people don't get schizophrenia after the age of 45, and it rarely occurs in young children.
What is a typical workday like for you?
Mostly treating patients with schizophrenia and other mental illnesses. I can prescribe and regulate medications and then send them to a psychologist who will use a talk therapy.
What exactly does a talk therapy do for the patients?
With the combination of medication and therapy, it helps the patients to cope and understand their disorder. Psychologists who specialize in schizophrenia can also use different techniques such as cognitive rehabilitation, remediation, and enhancement. It teaches the patients to communicate their own needs and to show them how to understand the needs of others.
Can schizophrenia be cured?
Unfortunately, it cannot be. Schizophrenia is a long-term illness. It can be treated with medication and therapy. It doesn't cure the disease, but it does help suppress some of the symptoms. Antipsychotic medication reduces psychotic symptoms such as hallucinations, delusions, paranoia, and disordered thinking.
Thank you for your time. Now we'll be talking to the mother of a schizophrenia patient and how her life has changed since her son got diagnosed. Everyone, please welcome Debbie.
Hello, Donna, and thank you for having me.
How has your life been different since your son has been diagnosed?
Well, the symptoms started when my son was about 19. He started to experience hallucinations and delusions. It started to get worse throughout the year, so he brought him to the doctor, and he was unfortunately diagnosed with schizophrenia. He was able to live at home for a couple of months while we went to countless doctors and psychologists and tried to get different opinions, and eventually his symptoms got so bad that we did have to put him in an assisted home with other patients that also were suffering from schizophrenia.
How has he been since he moved into the assisted living home?
Actually, a lot better. The medication helped a lot with his symptoms, and the therapy finally made a huge difference with him actually coping with the disease, as well as helping my husband and I. The therapy helps us learn how to live, and it helps him also.
Thank you for your time. That concludes our segment on schizophrenia. I hope you learned as much as I did about this disease, and special thanks to our guests who helped contribute to this show.